All right, earlier today we were talking to Michelle. She said her headaches went away, other pains went away. All of this stuff happened because she had her bite rebuilt. Now you said it's neuromuscular dentistry. What is that really, and how important is that to the outcome of the case?
It's very important to the outcome of the case. And the problem is that most dentists don't take the time to learn about this or even know how to treat this. What we do is we align the jaws where the muscles are the most relaxed position, and then we rebuild the bite around that. And then that allows the muscles to be in a more relaxed position, and that gets rid of her headaches.
Okay, and she didn't say that she came in here to even talk to you about her headaches. That just, they happened to go away.
That's correct.
And you said it was because you practice neuromuscular dentistry. Do you find that people have headaches all the time that they don't realize are related to their bites? Maybe they get their mouth the reconstruction done and then they get headaches? Is that a common problem?
We hear this all the time. Patients come into us and they do have headaches, and a lot of times it's because they've had piecemeal dentistry, you might say. They've had like a bridge placed here, a bridge placed there, and what's been done then is they're perpetuating their problem rather than correcting the problem. So if you're going to have everything done, you need to do it in a more correct fashion so that everything is done so the patient will be at their optimum position.
How important do you think neuromuscular dentistry or practicing it is to having the proper outcome in the case? Is it really that important?
It's extremely important, yes.
Is that something that you would maybe want to find out about a doctor before you let them?
Oh, definitely. Definitely.
Are there a lot? I mean, you said earlier there were very few that do.
There's very few dentists that know about neuromuscular techniques to reestablish the bite. And if you're going to have like extensive reconstruction done, you should have somebody who's trained in neuromuscular techniques to rebuild your bite.
Okay, let's go meet your next patient.
I had not been to the dentist in a long time. I mean, it was by far the worst fear I've ever had in my life. I mean, I've had nightmares about it. And my wife was constantly asking me to go to the dentist. Walking in Dr. Gonzales' office for the first time was, as I mentioned, it was probably, in my mind, the bravest thing I've ever done. I was so scared I couldn't sit down. They didn't do any work. They just talked to me. They didn't even look at my teeth at first. All they did was talk and just make me feel comfortable sitting in a chair, because this was something I could never do in the past. Made a detail of what each tooth needed to have done to it, and I looked at the list and it was like a lot of stuff had to be done, and I knew that. And then I said, well, that's going to take several visits, and he said, no, we'll do it all next Thursday. And I walked in here with by far the worst teeth of my family, and walked out of here with the best teeth of my family, and with absolutely no pain. He even gave me a prescription for some pain pills that I don't think I even took, because it really, it was a little sore, but I really didn't have any pain. I could tell before he even looked in my mouth that I wasn't going to be embarrassed by what he, because I don't know, his demeanor was just one that was like, okay, let's take a look, let's see what we have to work with here. And it was very, as I said, very soft spoken and very, I just, all of a sudden, I was immediately comfortable with him. They treat you incredibly, and I haven't had any bad experiences here. I mean, every member of the staff, Dr. Gonzales, everybody has been incredible.
What is the difference between a pain-free dentist, a sedation dentist, and IV sedation dentistry?
Well, to start with, the pain-free dentist, that just means he uses local anesthetic.
So if I read in the phone book pain-free, that doesn't really mean anything.
No, it doesn't mean anything.
Okay.
Most dentists are, quote, pain-free dentists, meaning they're using local anesthetics. You mentioned a sedation dentist. Sedation, a lot of times...
The pill. I heard the little blue pill. Oh, I have the little blue pill.
That usually means a little blue pill. And that is a form of sedation, but it's not very deep. And what it does is take people to a relaxed state. It makes you feel like you've had a few beers. And some people have no memory with that, depending on what drug they're giving them. Okay. We use IV sedation, which is a totally different category. We put them completely asleep.
So they're out just like they would be for a surgery?
Well, they're out like a surgery, but their reflexes are still intact. Their heart is beating on its own, and they're responsive, but they are completely asleep.
So because I met people today that were in the chair for a considerable amount of time. I met one lady, she was supposed to have 10 or 12 visits, and you did it all in one sitting.
That's correct.
She said she woke up, she went home, she slept for 4 hours, she got up, no pain, no swelling, And knowing what she had done, I would expect, I call them mouthfuls of crickets. You know, they talk in their mouth and they're, for months. Does IV sedation dentistry allow you to do, I don't want to say better, but more complete, or does it allow you to offer things to patients that you couldn't do under the little blue pill or relaxation dentistry or whatever else we were talking about?
Definitely. Well, to start off with, we give them other drugs too while they're sedated. We give them something to put them to sleep that makes them relax, but we also put in a pain medication. We use something called fentanyl, which is similar to morphine, but it's like 80 times stronger.
So they have no pain.
They have no pain.
Now, when she said she woke up, went home, slept for 4 hours, woke up, no pain, no swelling, felt great, and her teeth were all done.
Right.
Here's a woman that hadn't been to the dentist in 20 years, was told she needed 10 or 12 visits. I would assume, was supposed to have her gums laid open, and you fixed her gums with the laser, I guess.
Right.
I would assume, and maybe I don't know, that that person would be in tremendous pain, or my experience would be have a lot of pain and a lot of swelling. Is it because their body's relaxed? Is it the drugs you put in? You know, is it you? What is it that, see, because everybody, if it had been one person I talked to, and obviously I talked to a lot of people today too that we didn't get to show their interviews, they all said the same thing. They had these huge things done. They had these massive, their mouth completely rebuilt, and none of them had swelling or pain. The only thing they all had in common was they all had IV sedation dentistry.
That's right.
Is that a common occurrence? Do people wake up and not have that pain and swelling that they normally expect to have afterwards?
It's very common for several reasons. One, we use cutting-edge techniques. Our techniques are less invasive, and they allow the patient to heal.
Is that what's like the laser for her gums?
Lasers.
She was supposed to have 4 different gum surgeries, and
Exactly.
you did it in...
We use the lasers, plus some of the techniques we use in placing implants are less invasive, also allow you to heal faster, more rapidly. Then there's another trick we use too. We put medication in the IV also that makes you heal even faster too.
Okay, so when it comes to the sedation dentistry in the IV, how many dentists, I mean, let's say in Las Vegas here where you practice, how many dentists in Las Vegas, to the best of your knowledge, and I won't hold you to it, but how many of them practice sedation dentistry?
There's
IV sedation. I'm learning there's a big difference.
IV sedation, there's only a handful of us that practice IV sedation. I can't give you an exact number, but I would say it's probably less than 10 that I know of.
I live on the island of Bermuda, and I had a problem with my teeth. I had crowded mouth. I went on the website and I found Dr. Gonzales. Like, I go to Vegas, and this was the guy I need to see. I have always had a fear of the dentist. And with me having a fear of dentists, neglect of the teeth came. And I started to lose confidence in my smile, etc. So when I came over and visited him, it's Dr. Gonzales is like God's gift to dentistry. He knew I was fearful of the dentist, and I went with the blue pill. That's all she wrote. I woke up with this brilliant smile. From the minute I met Dr. Gonzales, I knew this is the individual I wanted to work on my mouth. Like, he was relaxed, and it made me relaxed. Friends, he would tell me I've lost weight. Like, the smile creates an illusion. Like the little tummy that I have, they do not see that. They see this brilliant smile, so it makes me look slimmer. This guy is high tech. He knows his business. His staff, they just blow my mind every time I come and visit. You know, they're great people. Like, they welcome you. You know, you're not just a patient. You're part of a family now, and that's what I like.
Knowing what this gives people, knowing what this can bring to the patient, why don't more dentists do it?
Well, number one, it takes an awful lot more of training or education, and there's a lot more expense involved in doing it too. And then you got to get certified through the state boards, and then you have your insurance malpractice carriers you have to deal with too. So all of those factors entered in.
So what if all those factors enter in? If all of that's the same, and obviously it's no different for you than it would be any other dentist, why did you go through it to be able to offer it?
Well, I saw a long time ago that I wanted to practice a different level of dentistry, and I wanted to be able to give to my patients something more than the other dentists couldn't do. And I found by doing this, it put me in a different category where when I don't just sort of like have patients come in every half hour. I spend the time with these patients, and I'm able to give them something that they can't get anywhere.
I had some neck pain, and I had, naturally, I'd been ignoring my teeth for years. And Dr. Gonzales told me that perhaps if I reshaped my mouth in a way that only he would know how to do, that it probably would relieve some of my back pain, some of my neck pain, and I'll be darned if it didn't. I thought, what could the mouth and the jaw have to do with your neck and your back? And so I was a little skeptical.
What we started with him was building up his bite first to find out where this jaw and this jaw lined up. Because he was having these neck pains, and I knew it had to do with more what we call cervical issues or the neck issues. So what we did was we aligned the jaw, that relaxed his muscles, and enabled him to put his head in a more comfortable position. Also, it opened his airway. It made it so he could breathe easier, and therefore allowing him to sit more erect. He doesn't know it, but that's what helped him out.
He told me the benefits of implants, and I said, I don't want to go through anything that painful. I'd rather just take my teeth out every night and put them in a jar. But boy, was I wrong. Came in, took a little blue pill before I got here, said hi to the doc and to his people that work here, including his wife Dee. The experience was relaxing. I was practically asleep before the surgery. When it was over, I remember seeing my wife. I remember driving home. I remember having 2 milkshakes in the car on the way home. I got home. I guess I took a nap. I woke up a couple hours later, and I said, he didn't do it. I yelled to my wife. I said, Mary, what happened? He didn't do anything. She said I was crazy. I ran to the mirror, and I looked, and I had 3 teeth where I had a bridge that was driving me crazy for years. Never had a bit of pain, didn't have any swelling, waited for the onset of pain, nothing happened, had a great night's sleep that night, woke up in the morning still expecting pain, nothing.
I was after Harvey to come in to get these implants then, but he didn't have enough space there to put them in. So I said, Harvey, we got to open your bite. And then he kept putting me off and putting me off and putting me off. And so I asked him, Harvey, what is the problem? So he tells me he's going to see an orthopedic surgeon. They're going to do some work on his neck. And I go, wait a minute. I said, come in, Harvey. Let me at least try this on you. I said, I know it'll help you. And he, like he said, he thought I was crazy. But we worked him up. We did a neuromuscular workup. We made him a fixed orthotic, put it in. Harvey comes back a month later. Harvey, how's your neck? Not an issue. That's what he told me. Then we put the implants in, and like he said, he had no pain that day. He didn't even know we did it.
You've been watching Medical News Network. I'm Mike Wiggenstein. For further information on this subject, or to find out how to become a guest on our show, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.
Thank you, Mike.